Welcome to Nursing School Explained, and this video on the Renin-Angiotensin-Aldosterone system as it relates to blood pressure control. And this entire system is built on helping to improve or elevate the patient's blood pressure. So when the blood pressure drops for any reason or whatever reason it is, this built-in system that affects multiple body organs will help us increase our blood pressure. And the easiest way to increase a pressure of a certain compartment is by narrowing the space, which then will increase the pressure in that tube. So think about this being a blood vessel. If we constrict the blood vessel, the pressure inside that blood vessel will go up. And this is exactly how the RAAS works. So when we have a low blood pressure for whatever reason, the liver releases an enzyme called angiotensinogen. That enzyme combines with renin that gets released from the kidney, also in response to low blood pressure, renin, renal or kidney. So these two combine to convert to angiotensin 1. Angio, blood vessel, tens, constrict. So this is exactly that constriction of the blood vessels I was just talking about. Now, if after the angiotensin 1 gets released, the blood pressure is sufficiently elevated or sufficiently higher to now be in the normal range, then these enzymes will go back to normal, blood pressure has been restored, and everything is good. But if the blood pressure doesn't get adequately elevated to a normal level with the release of angiotensin 1, the lungs in response will release ACE or angiotensin converting enzyme, and that ACE then converts angiotensin 1 to angiotensin 2. Again, the goal is to up the blood pressure, and then if the blood pressure is restored, everything is fine. These hormones go back to normal and the body functions normally. If the blood pressure is still too low, then the angiotensin 2 works on the adrenal glands of the kidneys to release aldosterone. And then aldosterone again works on the kidneys, but in a little bit of a different way. And in that case, the kidney then regulates blood pressure by increasing water and sodium absorption. These two always go together, sodium and water, and if we increase the water reabsorption, we expand our intravascular volume. We're not constricting that blood vessel, but we're actually making the volume inside that vessel larger, and therefore the blood pressure will go up. And this is exactly how the RAAS works. Now, the Renin-Angiotensin-Aldosterone system is super important because it's just a basic mechanism that is built into our physiology to help us restore blood pressure. And this happens without us knowing. Now, one point that is really important to notice is how many different roles or in how many different parts here the kidney is involved. So we have kidney releases renin, the adrenals release aldosterone, and then the kidney releases or reabsorbs water and sodium to increase blood pressure, which is exactly why the kidney is such an important organ when it comes to blood pressure control and also the perfusion of the entire body. Please give me a thumbs up if you've enjoyed this video. Also hit the subscribe button and check out the other videos in the fluid volume and fluid and electrolyte series so that you can get the whole picture of how the body regulates fluids and electrolytes. Thanks for watching.